All right, Mr. Allen has finally got his act together. Sorry, guys. It's been a long afternoon. Okay, so we're going to go over cupping first. So in lab last week with Dr. K gave us a really cool little rundown on cupping, and everybody got to play with it, and everybody got to do some cupping on each other, and we got to see some demos on some, and we got to see some people use it like all along their back. We had some in one lab. We had some people do it all over their body. It was just looked really, really wild, but it's really, really cool that we can do that. It's not new. The origins go back to the first reference to what we know as cupping in modern day medicine goes back to 1550 BC in northern Africa, and it was an Egyptian hieroglyph, and it was I don't know exactly what it said, but it just was describing the exact art of cupping for trigger point therapy, which we do today in ancient Egypt. So it's pretty cool. It's probably mostly well known in Chinese medicine, and most in Eastern Asian cultures. Even some of the followers of Islam say that the Prophet Muhammad was a user and an advocate of cupping, and that he used cupping. So that's pretty cool. So what does it look like? Well, this is what most people think of when they think of cupping. We usually don't have quite this many cups on at a time, but we do have several on at one time, and we may have this many on at one time in some extreme cases. But the cups are this is what the cups look like, as you've all seen. The cup, and during the procedure, the therapist puts special cups on the skin to create suction, and it causes the tissue beneath the cup to be drawn up and swell up in the cup. That causes a lot of increased blood flow to come up into that skin that's in the cup. So that's what causes all the redness and all the bruising that we see. And I don't have to tell you that, you all already knew that. So we've heard of it, but what's its purpose? What can it help with? There is a lot there. I'll show you. You can see my references at the end of this. There is evidence out there that does support cupping in a lot of various different pathologies, but there's no study out there like in Eastern countries or in Western cultures that shows that cupping is like the way to go. It's just showing that it's another modality that seems to work a lot of times for some people, just like any modality that we have. It's just another modality we have that works really well for some people it's not going to work for. But there is good evidence to show that this can help with headaches, especially migraine headaches. This can, sometimes people do some cupping on the temporalis muscles, or on the the capital extensors of the neck, and that can help with tension headaches and migraine headaches, neck pain, low back pain. Muscular trigger points is the most common and well known, and this says knee pain, but pain anywhere. A lot of Eastern medicine, and they do cupping, and they have methods for helping with menstrual cramps, which some women's health therapists do here in the U.S. They do help women that have a lot of they go through a lot of pain, have a lot of pain during their period, and they help them. They can do cupping for that, and they can teach them to do that at home. They do it for infertility. Now, I don't know the science behind that. I don't even know if it is a science. It might be a hocus pocus, feel good kind of thing. I don't even know how they think it works, but who knows? This has been around for a long time, so they may know what they're talking about. Who knows? Little bit of evidence, but not as strong of evidence that it can help with hypertension, rheumatoid arthritis, diabetes. I don't know about how it would help at all with mental health disorders, besides helping you get better with just getting rid of tension in your muscles and being calmer, and maybe helping you be calmer and have less anxiety. a little bit of anecdotal evidence about heart disease and infections too. But usually infections, heart disorders, and diabetes are usually strong contraindications against cupping. So I don't know why there is studies showing cup use for cupping on those people, but usually we don't want to do it on those people. But we'll talk about contraindications later. There's not many. While this is just a map of where we tend to get the major trigger points in the major muscles of the body. Now, this is by no means the only places that we can get trigger points, but these are the 14 major trigger points in the areas of the body. And this is in the front of the body and the back of the body. A lot of these areas are going to be the same, if not in really similar spots on the same people, like from one person to the next. Like if people are going to have pain in their upper traps, it might tend to be in the same place, or in between the shoulder blades, or in the pecs, it might tend to be maybe more in the upper pecs. That's not saying you can't get it down in other parts of the muscle, but these are the most common places you'll get it. And they're not showing anything on the bottom of the feet. It does say if you look at the front picture, it shows dots on the front of the foot, and it says tired feet and plantar fasciitis in the arch. I think those dots need to be on the other picture where it says the posterior side of the body, because you definitely can do it on the bottom of the feet for plantar fasciitis. You wouldn't do it on the top of the foot for that. There's different types of cupping. Dr. K went over this with you last week. We have dry cupping, which is what is most common out there right now, and that's what we did with just a cupping with a dry cup and dry suction. There's wet cupping, which is where that's where a thin needle, or they actually take a small scalpel, and they'll either prick the skin and draw blood, or they'll make a little cut and they'll actually cause bleeding, and then they'll do the cupping over that. A lot of times, I did see Chris in our class doing this last week. He was doing some cupping with the oil and the sliding cupping, which you can do for mobilizing a trigger point. And so you put some special oil that comes with it's just a special oil that comes with the cupping kit, or you can use lotion. Dr. K was using lotion in the other class. Put a thin layer on the skin, not a lot or anything, just a very thin layer right over the area of the trigger point. And then you do your cupping over that, take your suction, take the air out, and then you can move the cup around slowly just in that area, and it can help break up those trigger points even further. There's fire cupping, where they use fire to take the oxygen and the air burn the oxygen out of the cup, and that's what creates the suctioning. And before they used glass and ceramic cups, they actually used animal horns for cupping, and they would use the fire method with the animal horns. So when I was getting ready for this presentation, I did see a picture of you can just Google it, animal horn cupping, and look on images, and you'll be able to see people with usually they're water buffalo horns, and they're usually black ones that they have. And I saw a guy with them all sticking all over his back. He looked like a mutant or something, but that's one of the most common ways that they used to do it back before they finally developed glass and ceramic. Here's some of the different types. You can see the common glass type over here. You can see the fire cupping, which I've never seen that in person, but I would not want that done on me, but I'm sure it's done safely, and because it doesn't burn the person at all, or they wouldn't do it. You can see the wet cupping here, where their blood is actually starting to fill the cup, and that is actually about how much blood they let come out of each cup. So they keep it on there for a few minutes, and it's not just a few drops of blood, it's quite a bit. So practitioners in Texas, as far as I know, are not allowed to do wet cupping. And I don't think anybody in the US, as far as PT and PT, I know not PTA, and I'm pretty sure not PT can do, I would not think the APTA would let us do wet cupping. Actually, when I was looking up the Texas scope of practice, there was a therapist last year that brought to the board, he wanted evidence of wet cupping for pain, for trigger point relief, and wanted that to be part of the PT scope of practice in Texas, but they denied it because they said it was too invasive because it drew blood and it was something that should be done by like a licensed physician. So that's why Texas denied it at least a year ago or 2 years ago. Over here in the far left-hand bottom corner, you can see these blue cups. Those are actually plastic or rubber, and what you do, they're kind of like springy, and you actually just put them on the person's skin, and you just press down into it, and all the air just kind of just mushes out the bottom, and then it creates a suction force whenever it's trying to the rubber is trying to recoil, and that's the cup. And you can see that they have a few different sizes of those too. But really, no matter what the method, the results are usually about, they're doing it for the same reasons, and you can do the different types of cupping for all the different pathologies we talked about earlier. So exactly how do you do it? Well, first you would do, and Dr. K showed us this last week, you're going to palpate the problematic area for a trigger point. And I'm specifically talking about trigger point therapy today, just in case you haven't noticed. So you're going to palpate this problematic area for a trigger point. And then you're going to make sure the person is in their most comfortable position they can be. That's almost always going to be in supine or prone, or draped or lying, or if it's in their shoulder, if it's in their upper traps, maybe they want to sit up, but most of the time they're probably going to want to be laying down or something like that, or draped over a bolster. You're going to use the thin layer of oil or lotion over the area. You apply the cup with the vacuum, and if using the vacuum, you only want to use 1 or 2 pumps until the skin rises into the cup. Now, different brands are going to have different strengths of pumps, and different pumps are going to be different. But usually, you don't want to do more than 2 pumps. It's usually about the max. Okay. Now, maybe if the pump is kind of weak, you might do three quick pumps, but you don't want the skin to rise that far into the cup. Then you're going to detach the vacuum and repeat it on the areas around it, if there are other areas too. If you're going to do the moving cupping, then that's when you would slide the cup along the trigger point, around the area in circles and in like cross fiction manners to break up the soft tissue. And you would only want to leave the cup for no more than 3 to 5 minutes at a time, because you don't want to cause any more hematoma or any more bruising than that. Any more than that, especially if you're doing the moving cupping, you can cause a lot of damage, and you'll see a picture of some pretty bad damage in a minute. There are actually some contraindications for cupping. So think back to your PTA techniques days. This is just like any other modality. So we have contraindications. So if you have excessively dry or cracked skin, you wouldn't want to do this over that part of that kind of skin. Also, think about older people, geriatrics, they have thin skin and their skin tears very easily. So if their skin is very thin and they tend to tear easily and cut easily and bruise easily, you would never, why would you do cupping on them? You're just going to tear their skin open with the vacuum all over their body. It's going to be terrible. If there's already an open wound there of any size, you don't want to do the cupping over that at all. Obviously, if there's a fracture around the area, not there, around a dislocated joint. Anybody that has bleeding disorders, any kind of like sickle cell anemia or clotting disorders or anemia, you don't want to do it on them. People with muscular dystrophy, this can actually cause further damage to their muscles, which could be irreversible because remember, their muscles are wasting away anyway when they have that disease. So cupping could actually do further damage to their muscle tissue. Obviously, if you're doing, if anybody that's just scared of it, you don't want to do it. You don't want to do it anybody below 2 years of age. 7 years of age for wet cupping. None of us are going to be doing wet cupping, but if you're going to be doing peds, it is recommend, you can do cupping on peds, but it's not recommended below 2 years of age. And it's probably not something that you want to subject a kid to anyway, leaving bruises on them. So you want to be careful of that. If there's an infection or abscess in the area, obviously you wouldn't do cupping over that. Or if there's an area that has an excessive swelling that's either from an injury, or that's either chronic, acute swelling, or a swelling that's from a pathology like congestive heart failure or lymphedema or something like that. You would never do cupping over an area like that. This is a very severe case. This is a bad cupping accident. These are not just this is a picture of cupping going wrong. Now, I don't know how long you have to leave the cups in place to get damage like that, but I don't know if y'all can see this on your screen, but on my screen, I can see that looks like necrotic tissue. Now, I just pulled this picture from Google, and it was just from an Eastern Chinese medicine website that was about cupping, but this person might have, I don't know, this looks like they could have even been burned with fire cupping or something, but I don't know how a person can tolerate that long and let something be damaged like that. Or maybe the practitioner did the cupping on the same area more than one time, but that's pretty bad. So bruising is normal, as we've all seen on our classmates, and it takes about 1 to 10 days to heal. But if you're it's okay to do cupping repeatedly, but you don't need to do cupping on the same area until the bruise is either gone completely or almost gone completely. And bruising, like when it's almost gone, almost gets to that kind of like gray or greenish kind of phase where it's not red or purple anymore. It's almost kind of a weird tint, brown green tint on your skin. That would probably be okay. But if it's still red or purple, you want to wait until that bruise heals. Like I said in the beginning of the presentation, PTs and PTAs are allowed to do cupping in Texas. You just are expected to be trained with it like anything else. And that would be, and as far as cupping goes, that's not really a certification that anybody can get, and it's not like there's continuing education courses you can go to, but it's not any kind of credential or anything you get. So as long as you go to a class and learn how to do it, or learn from therapists at your facility that do it and they're competent in it, that would count too. As long as you know what you're doing, that would be the only time I would do it, just like anything else. And as anything else, the cupping has to be part of the written plan of care for you to do it. Remember, if it just says pain modality, if the plan of care says use decreased pain with pain modalities as needed, well, there you go. It's open-ended. You can do cupping without asking the PT. But if they didn't write cupping, just go ask, hey, can I do cupping on this person? They have trigger points, or they're having some spasms in their lower back due to an injury, or this person has fibromyalgia. Cupping tends to be really good for fibromyalgia patients. Can I use that? Most likely the PT, unless they have a good contraindication or a good reason for not doing it, they're going to let you do it. And here's my references. And there's a lot, all the literature that's out there is done in China. So everything's really heavily based in China. But it's also done, there's a lot of US studies being done around the world too, but just not as much. So anybody have any quick questions. I know a lot of y'all have done cupping, not just in lab, but like on your clinicals too. So do you want to add anything, or did I miss anything? Or I'm sure I maybe misspoke and said something that you may correct me on, because you've probably done it more than me. So anybody feel free to chime in right now, if you
All
want.
I gotta say is that whoever did that guy with with the necrotic tissue on his back, they did something wrong.
Yes. That was crazy.
Is there a CPT code for this?
It's just billed under manual therapy right now. Whatever the manual therapy code is. I know y'all know that. I don't know it. But whatever you bill for manual therapy, you bill it under that. Yep. And if you think about it, because you can bill it as manual, because if you're doing it for trigger point release, then you're actually moving the cup around, and that's kind of the same as doing soft tissue massage or soft tissue mobilization. And then if you're just doing it for like fibromyalgia relief, or for other pain reliefs, or for spasms or things like that, I mean, basically that is manual therapy right there. We're just providing pressure. We're just, instead of providing pressure downward into the body, we're providing pressure with a vacuum force upwards, or pulling on the area instead of pushing on it. But we end up with the same response, which is less pain. So cool. All right. So that wasn't too bad. So do y'all want to just finish up with dry needling, which is also pretty quick?
Yes.
All right, let's go into that. So give me a second to get out of this PowerPoint and into the next one. I have a lot of videos for dry needling, so I have to be honest, some of these videos made me think twice about wanting to be certified for dry needling. Screen share, there we go. Okay. Introduction to dry needling. Okay, so this is just, and I just have to tell you, since dry needling has, like I said, this was not a thing even therapists were close to even thinking about back when I graduated in 2005, which was forever ago. So we didn't learn this in school, and I haven't been certified in it. I do when we have in-person lectures, I usually have a guest lecturer come in and do this, and they actually will do a little bit of dry needling on the students, usually just on arms and legs, and just like a needle or two here and there. But we don't let y'all do it. She'll do it usually, but it's not really that much fun to the students. So y'all aren't going to be missing much, because we don't have a guest speaker usually, because y'all just have to sit there and watch her, and people don't like to do that. So but let's talk about what is dry needling. What is it? Well, it is slightly invasive because we are puncturing the skin, but it's where a fine, very fine, or needle, or an acupuncture needle is inserted into the skin and the muscle, and it's aimed mostly at myofascial trigger points, which we all know what trigger points are. Where did this come from? So kind of like cupping, the origins of dry needling lie back in ancient Chinese medicine, and actually lies in the origins of acupuncture. So acupuncture has been around. We all know what acupuncture is. It's been around for thousands of years. You can look at these pictures I have here. By no means do I expect you to read the little bitty Mandarin symbols on there, but every symbol or every dot that they're pointing to on the body in these pictures are acupuncture spots that correspond to a certain area or certain organ or certain pathology that can happen. So, and the area that you insert the needle many times let me say this, in the acupuncture world, the dots and the mapping is all over the place. Like you can have, like for certain organs, they'll have it like in your foot, and then if you have a shoulder problem, they'll have it in your leg, and then if you have a gallbladder problem, they'll have it somewhere else, and then it's just the mapping is all over the place in acupuncture, but they've stuck to those same mappings forever. And I've actually had acupuncture for something simple once before, and I went through it for about a month, and I was doing it on top of physical therapy actually anyway, so who knows if it was actually helping, or it was probably more the therapy anyway. I knew that at the time, but I really do think that in my mind, I really do think that the acupuncture helped me with my trigger points in my spasms I was having, because it helped me relax a lot more. Because every time I left the acupuncturist, I always felt way better than when I left my physical therapist. So I don't know, there's something to be said about it, but I know it's more than just musculoskeletal pain. Just about any pathology in the body you can think of that you've learned in anything in medicine, acupuncture has something that they can do for it. And that's why it's been around for so long. To be an acupuncturist, you actually have to be if you live overseas, you have to be a doctor of some type, and it's usually a doctor of Chinese medicine. In the US, you have to go through a credentialed Chinese medicine acupuncture program, and it's usually they're usually a 2-year program. And you have to have, and it can't, not just anybody can do it. So you usually have to have like at least a bachelor's or a master's degree in something else first before they'll let you in. So a lot of times, it's actually very common that dietitians and nutritionists are actually acupuncturists too, because they acupuncturists qualified like Chinese acupuncturists will sell herbs and herbal medicine along with their acupuncture. So a lot of dietitians in the US and dietitians and those people will tend to have both degrees, so they can practice both of them, and that's how they basically do their practices through both. The modern day dry needling came about in 1979 by this guy, Dr. Lewitt. He was a Czech physician, and he did a lot of trigger point injections for people, but he did it with different analgesics. So like he did it with different steroid injections, and he did nerve blocks and things like that, and then just all kinds of different chemicals that would help numb the pain. Well, he found over time that basically no matter what type of chemical or medicine or analgesic he used on trigger points, the result was exactly the same. It didn't matter what medicine he used, it was the needle that mattered. So he started trials of modern day dry needling, just using hypodermic needles, but no medicine, and just sticking them in the trigger points. And then that came about to actually moving the needles around and putting them, like poking them in and out of the skin to get what they call a twitch response, and that can help a lot of times with the healing process. He was the first person to discover this, and he's the one that's credited with this. And this is I don't know. I think this is a very recent picture of him. I don't think he's dead, but this is a pretty recent picture. And if you care to know, I just grabbed this picture off of Google. But the needles are super duper 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 thin. So if you compare this chart, look how big a match is, and then all the way down to, you got a hypodermic needle, what they stick under you to give you an injection is next. Then you've got a sewing needle as next, then the dry needle. It's only 0.25 millimeters thick. That's super duper thin. It's so thin that most of the time people don't even feel the needle go into their body. when I had acupuncture, it's the exact same needle. I never felt that the needles go into my body. I only felt the tap of the finger to make the needle. I just felt the pressure of the lady's finger. I never felt the needle. And it should be exactly when you do dry needling, you should only just barely tap the top of the needle to insert the needle, and that should be basically painless. So it should be a painless procedure in the beginning for the person, but then you're going to start getting a little bit more invasive after that. We'll see a video of that in a minute. But here's what the needles are like when the person's holding them. You see they have a pretty large plastic handle for you to have a really good hold on to. They come in large packs, and they are sterile. So they are one-time use, and they are sterile. So there's going to be very low risk of infection. And you do need to wear gloves when you're doing this, because this is an invasive procedure. We do need to be wearing gloves because of the risk of bleeding. So don't do it like this picture of one hand is showing without a glove. You do need to have gloves on. Okay, so there's 3 videos here. Now, don't think they're long videos that I just chose just to take up time. They actually are I searched a long time for some cool videos, so I think these are pretty cool. So let's watch these. So let me get out of share and bring it back up somehow. Hyperlink. Okay. Share. Okay. So this is an overview.
Filament needle into a muscle or tendon that a patient perceives as painful. And it's been shown to improve muscle function as well as decrease pain.
When we look at and we assess people, there's kind of the most basic ideas. There's 3 layers of tissue there. So you've got the superficial level where the skin kind of resides, and that starts to move, and it should move pretty freely. Underneath that intermediate level of tissue, that's more of your muscle tissue, and that's where you start to get into some of the fibers and the trigger points. And then there's the deep layer of tissue, which is underneath that, and it's muscular and kind of goes down to the bone. When we're deciding if dry needling is an appropriate treatment for you, we start out with just a basic palpation and look at how you respond to that palpation. If we can push on a muscle and recreate your symptoms, chances are working with that muscle either with our hands or with dry needling will help to improve it. Once we've treated you a few times with our hands, we can then use that to make an assessment on do we think we need a more potent treatment. In my experience, dry needling tends to be a more intense version of the hands-on myofascial techniques and soft tissue mobilizations that we commonly perform in physical therapy. So if you're only noticing a day or 2 worth of relief from your symptoms with your hands-on treatment, we can try dry needling and see if that piggybacks and gives you a more effective treatment that lasts a little bit longer and helps you to perform your exercises and your common daily movements in a much more normal loading pattern that we would expect. So we'll take the needle and we will directly insert it into the muscle and move it around until we find either a twitch response or some cramping. And that indicates to us that we've found a trigger point that would benefit from the dry needling. When you have a trigger point, what we think happens is those fibers start to kind of knot up a little bit, and they overlie each other in a very uneven pattern, almost like pickup sticks on the ground. And when we poke it with that dry needle, it causes a change in that muscle, and somehow those muscle fibers actually start to realign better, and that trigger point starts to release. After that, we give them a couple of days to recover, make sure that everything settles down, and then reassess how they move and see if that made an impact in their tension or in their movement patterns so that we can assess how much that myofascial tightness or those trigger points were contributing to their symptoms. Ideally, as we do more and more dry needling, you start to see that cumulative effect, and those muscles and those trigger points do start to go away. Patients more commonly will report after the first time it feels a little bit nicer and it doesn't bother them as much. It's not quite as sore and achy afterwards, so they're much more comfortable with it. And as we do it repeatedly, that tension should actually go away. When it's done in conjunction with a good home exercise program to re-educate the patient in how they move, it works very potently to help control that tension and get you reloading your body in ways that we were hoping to load up those joints to take stress and relieve symptoms.
The application of dry needling is pretty wide, and And that's one of the benefits of it because there's very low risk of any adverse reactions occurring to it. So anyone with musculoskeletal pain could benefit from dry needling.
Sorry guys, I was talking and I didn't know I was muted. Okay, so this next video is more about showing you an actual procedure. So they're going to be doing dry needling on the upper traps on a real patient. So, and this person is going to have a giant spasm and twitch response. I want you to pay attention to this video really carefully. And it's going to be a little bit quicker, but it shows a lot more. So let me click it. Got it.
That was just released on the market after billions of dollars.
Okay, so we're going to do a demonstration of dry needling on this patient's upper trap. First, I wanted to show you guys the different size needles. This is a 60, so it's a little bit larger than the 50, and then this is a 30 millimeter. The choice of the size or length of the needle and diameter of the needle depends on the muscle you're doing, depends on the patient. For the most part, I use a 30 by 50 and has pretty good results with that. There's different brands of needles out there. So we already have her prepared, so usually we'll swab the area a little bit. There's not much research showing that that's going to be any more effective as far as decreasing bacteria in the area. But let's just say that that's been done. Gloves are on. And what we're going to do is palpate for trigger points. So you want to understand the muscle that you're going after. You're going to be kind of parallel to the muscle, and then you're going to palpate perpendicular. Okay? And you're basically looking for a taut band, and then you're going to look for that hyper irritable spot, which kind of feels like a marble or even the size of a pinhead. As you get good at palpating for trigger points, you'll be able to feel that. Now with the upper trap, I'm actually going to kind of grab the muscle because I'm going to be needling towards my hand, my fingers on the bottom. So I know that I'm completely on muscle right now. I'm going to try and trap that trigger point right between my fingers. Okay. And now I'm going to put the tube directly on the skin, push down a little bit, and then it's just a quick tap. And if you push down enough and tap quick enough, she's not really going to feel the insertion of that needle. Okay. So now the motion is kind of a pecking motion, in and out, or pistoning motion. And we're looking for what's called a local twitch response. So hopefully you'll be able to see this on the video as we get to the twitch. She's getting full body twitches. So we try to do
So you go watch her scapula. You can
kind of
see
in a
it twitching.
clockwise fashion. If you want to redirect the needle, you got to pull it out between the skin and fascia and then redirect and then go back in. The idea is to get rid of as many of the twitches in the area as possible. You don't want to just go in and do one twitch. Okay? You pull out and you apply what's called hemostasis, and that prevents any bleeding. And as you'll see, there's no blood at all involved.
Okay. that was upper trap, and y'all got to see. Did y'all see the twitching that was going on? So that's what they want to see there. Let me get this again. And then there, okay, so we've got one more. And this will be low back pain. And this will be quick. And then we're just about done. Okay, we're gonna watch low back pain now.
Of therapy interventions in the treatment of low back pain. In addition to the normal joint mobilization and corrective exercises, we also like to utilize functional dry needling. In functional dry needling, we insert a tiny monofilament needle into your muscles to help reduce the amount of spasm and tension within that segment. In doing so, we increase the blood flow and promote healing in a very safe and helpful manner. We're going to demonstrate functional dry needling for the alleviation and treatment in low back pain. We use a tiny monofilament needle to go into the muscle and help break up any tight tissue or trigger points. By doing so, we identify the tight spot, we bracket around the tissue, and insert the needle into the skin. We then angle back down into the muscle until that muscle elicits a twitch, thus breaking up the knot. From there, we can leave the needle, or we can insert a secondary needle and use electrical stimulation that helps cut down on post-needle soreness. The key with functional dry needling is the needle insertion into the muscle. However, the electrical stimulation will help with soreness later on that day and into the next day. By inserting a secondary needle at the level below, we can angle back. There we go. And use alligator clips to elicit a muscle contraction out of the tissue.
Watch this, this is cool.
If we look closely, we can see that muscle bouncing up and down as that tissue not only gets increased blood flow, but also starts to relax.
Okay. So that's all the videos I had. Just wanted to show y'all a few. They were pretty cool, I thought. Let me get back to the PowerPoint. We just have a few slides left. So I just wanted y'all to see actually some procedures, since, you know, can't really do it in the lab. So they talked about in the videos, I'm not going to read this. They talked about the physiology over it a lot. They do think that it, but one of the guys talked about how they think that it helps reduce trigger points by breaking up the adhesions of muscle tissue and collagen that are all in different layers, and helps straighten them up to be straight, to break up the trigger point. They also think that that needling also improves the acetylcholine levels at the motor end plates, so that helps in tissue healing. And this also helps, if you remember the gate control theory of pain, this can gate the pain, and it also releases your endogenous opioids too. So like I said, in Texas, PTs and PTAs are allowed to do dry needling. Like I said, this is fairly new in recent years. There's a lot of, you have to do dry needling, you have to be trained, and you have to go through a certain number of credentialed courses in dry needling from certified, that are dry needling schools of learning out there that are credentialed. There's just a few of them out there, but their courses are pretty much absolutely the same. There's just a little bit different. Some of them are a little bit longer on weekends than others, but they're all about 2 to 3 days each, and they go in different levels. And the level, and they all call it like dry needling 1, 2, 3, and then 4 and then beyond. Dry needling 1 will always be the basics, and then we'll usually include one body part and then like the lower body or the low back or the neck. After you've done dry needling 1, then you're qualified to do dry needling on the body part that you've been trained for and things that you may learn from other practitioners. Now, if you want to continue your education, you have to take more classes to learn those. So in dry needling and continue classes, if you want to do like the whole body, you've got to take all of the classes to learn it all. And they are fairly vigorous courses. Each of them are 2. They're always full weekend courses on site. They're very expensive. They're about between $600 to $900 each, just depending on the company. You know, if you're lucky, your company will pay for it. You know, just as part of, if you agree to stay with them for a few years, it's, you know, sometimes companies will do that. It's very common. So you may can work a deal or something out with your boss or something. But yeah, so that's how you go. That's how you get trained. So they've been studying the evidence for a few years now, and the evidence in the literature, in the scientific literature for dry needling is pretty slim. And opinions vary very widely over its effectiveness. The protocols, everybody has their own protocol. There's a lot of different schools of thought out there on it. Safety is also a concern too, about things. And so there's a lot there. In any study you look at, they're all going to say completely different things. And when I looked up, when I was going through the literature to make this presentation, there was just like nothing out there. I mean, and there was very few systematic reviews. They were all almost clinical trials. There were no double-blind controlled studies. So there's not a lot of studies out there. But what the studies that we do have show us that the evidence does show that this does have its place in our toolbox of tools in treating patients. So it's not something that we're just gonna, every patient that comes through our door, we're gonna start sticking needles in them and dry needling them. But it's just another skill that we can gain and that we can have in our arsenal to help treat people. So it's just another good thing that we can have in our education. Now, you may want to go into an area of treatment that has nothing to do with this, and that's okay. This is just something that some people like doing. It's very popular right now, especially in the in ortho and manual fields. But if you think about it, in the neuro field, there is some evidence that well, if you think about it, neuro people have a lot of trigger points because they sit in their chair all day, or they may be hemiplegic, or they may compensate, maybe use compensatory strategies, and they develop overuse. So they develop trigger points. So neuro patients neuro patients get trigger points. And I'm not just saying this because I'm a neuro guy, and I think everybody should like neuro, but the strongest evidence that I actually found out there on the internet, on Pedro, was for stroke patients, and it was for short-term spasticity relief in the biceps. And so this was interesting that they did only a couple of sessions of dry needling in stroke patients that had spasticity in their biceps on their hemiplegic side. And at 4 weeks, they still showed decreased spasticity of that side, which was letting them move better and move in a more normal pattern. So that just goes to show you that before I read that article, I had never heard of trigger points being used for spasticity. And that got me excited. I was like, that's really awesome, because we need spasticity is something that people live with all their life. And the more tools we can get to help with spasticity, I mean, that's going to really, really help our profession a lot. And that's just another thing that people are going to flock to us for, because we're always going to have stroke patients. People are always going to have TBIs. We're always going to have spasticity to deal with. These are a few of my references. I really had a lot more of these, but I mean, these are just some of them. These are this is where I got the majority of my information. feel free to look at any of them. Feel free to look at anything on YouTube. When I was looking for videos to show you guys on YouTube, there was there was so much really cool stuff out there that's being put out there by a lot of clinics and universities just to demonstrate dry needling. So look up some stuff if you're interested, and if you want to look at getting certified in it, I mean, you probably want to wait till you get a little bit more, at least a year of experience under your belt to make sure you know what area you want to go into. But go ahead and start looking if you want to, if you're interested in it. Look at the courses and just search dry needling courses. They're actually always, they travel around the country, so they're only offered in certain cities at certain times of the year, so you kind of have to be open to traveling a lot, but just get an idea of how they operate and how much they cost and things like that, and maybe think about that if you're ever going to try to negotiate getting certified with your boss or something.
So I did my in-service on dry needling.
Yeah.
And what I found is you actually don't have to be certified. There's like a huge gray area in Texas. Like,
really?
A PT could literally grab a box of needles and go to town if they wanted to. The APTA's definition is they want you to be a master of your craft before you start needling. And that's it. There's no like this many hours, this many like continuing. I'm not saying go out and do that, but and what I found was there was no CPT code for that either. But yeah, you don't have to get certified in anything.
Really?
Nope.
I did not know that.
You could even like.
That's a little scary.
Yeah. Yep. So.
That's a little scary.
Mm-hmm.
Okay, well, hopefully I will never hear that any of the 20 of you are out there doing a rogue dry needling without going through the training, or I will come after you. And Dr. D will come after you. So don't do it. Anybody have any questions or anything before we go? So labs tomorrow. Remember, we have our pulmonary comps tomorrow. If you have to make up any comps, there's a couple of y'all. If you don't mind, after everybody else logs out, just stay on for just a second so we can talk about what time we want to meet. But other than that, if you don't have any questions, you are free to go, and I'll see you in lab tomorrow.
Thank you, Mr. Allen.
All right, see y'all later.
Thank you, Mr. Allen.